Hi, Steve from Wandsworth Physiotherapy. So autoimmune diseases are where your own immune system starts to attack your own body tissues, and you might think that this is just down to pure bad luck or it's down to your genes, and this is just simply not the case. There may well be a genetic predisposition in terms of your genes, but it's the environment or your lifestyle which is the key determining factor. It could be an environmental exposure to a virus or bacteria or a food, protein or antigen, something you're allergic to that triggers this disease. And then there's a loss of tolerance in your immune system and molecular mimicry. And what that means is your immune system no longer recognizes your tissue as self. It looks at it as something else, something foreign, and it needs to attack it. So in the case of rheumatoid arthritis, your immune system looks at the joint tissue of your hands and your feet and your wrists as foreign, and it attacks it, and you get pain and inflammation in these joints. Or in ankylosing spondylitis, your immune system looks at the spinal collagen and the ligaments and the joints as a non-self and attacks it. Now there are some things that you can do. Conventional treatment would be physiotherapy, anti-inflammatory drugs, but there's a thought pattern that some of the triggers for these diseases can actually be bacterial infections. So for example, rheumatoid arthritis could be a Proteus infection, and ankylosing spondylitis could be a Klebsiella infection. Now these bacterial infections usually start in the gut, and if you want to look at this from a nutritional point of view, you would start by trying to clean the gut up and clean your diet up. Now bacteria thrives on starch and carbohydrate, so if you starve the bacteria, you're going to kill it. So if you go on a low carbohydrate diet, cut out bread, pasta, rice, potatoes, that's one way of killing the bacteria in your gut. There are some antimicrobial, antibacterial supplements that you could take, like wormwood, for example, but that's a whole different topic that we would need to cover. And you can then also take probiotics and healthy bacteria, so the healthy bacteria can compete with and oust the bad bacteria. So there's lots of other nutritional things that you can do to manage the symptoms of autoimmune disease. You can't necessarily cure them, but you can certainly manage the symptoms. And if that's the case, just download my Nutrition for Musculoskeletal Disorders ebook at the bottom of this video.